Hello, and welcome to our poster presentation on the impact of climate change on human lactation. My name is Daryl Traylor, and I'm proud to introduce my co-authors, Winter Cameron, Ebony E. Anderson, Brianna Clark, Robert Henderson, and Lena Clark. This poster presents the results of a comprehensive review of the literature that we conducted to explore how climate change affects lactation, particularly in vulnerable populations. As we all know, climate change has far-reaching effects on human health. However, one critical area that demands more attention is maternal and infant health, specifically in the context of lactating individuals. Rising temperatures, water scarcity, and heat stress are increasing concerns across the globe. For individuals who are breastfeeding or chest feeding, these environmental challenges directly impact milk production and milk quality, and this poses significant risk to infant health. This issue is especially relevant for those living in Arizona and the broader southwestern United States, where extreme heat and persistent drought conditions are prevalent. As climate change intensifies, these stressors will likely worsen, and individuals from low-income and marginalized communities will face even greater risk. This makes it critical to understand how these challenges will impact human health going forward. The purpose of our project was fourfold. We wanted to examine the biological and physiological impacts of climate change and heat stress on lactating individuals. We wanted to examine literature that addressed socioeconomic and health disparities related to climate change and heat stress. We wanted to examine literature that examined public health and policy related to climate change and heat stress. And finally, we wanted to identify research gaps on this topic. To conduct our review, we employed a systematic search strategy across several major databases, including PubMed, Web of Science, Scopus, Google Scholar, and JSTOR. We also consulted general search engines such as Google and Bing. Our search terms included combinations of phrases such as global climate change, human lactation, maternal health, heat stress, breastfeeding, chest feeding, environmental toxins, water scarcity, and dehydration. We used Boolean operators to filter the results to articles specifically addressing the intersections of climate change, lactation, and maternal health. Inclusion criteria included peer review articles, case reports, epidemiological studies, policy analyses, and reviews published in English. We focused on studies discussing the impacts of climate change on lactation, maternal health, and infant health outcomes. We excluded articles that were not directly related to climate change or lactation, as well as non-English publications. Opinion pieces and articles without full text access were also excluded. From our search, we initially screened 365 records. After removing duplicates and applying our inclusion and exclusion criteria, we examined 87 studies in detail, which informed our key findings and conclusions. From our literature review, which covered studies across multiple scientific databases, we identified several significant challenges and mitigation strategies. Heat stress. One of the most critical findings is how heat stress negatively affects lactation by disrupting the hormonal balance needed for milk production and milk ejection. For example, heat stress reduces oxytocin levels, which are essential for breastfeeding and chest feeding. Dehydration. Dehydration due to heat stress compounds the issue by reducing blood flow to the mammary glands, which further hampers milk synthesis and milk secretion. Malnutrition and water scarcity. Climate change exacerbates water scarcity, reducing maternal hydration and milk quality, which ultimately leads to malnutrition in infants, particularly in already resource-limited areas. Vulnerability of lactating individuals. Low-income individuals, rural populations, and marginalized ethnic groups are disproportionately affected. Natural disasters, displacement, and limited access to health care further strain their ability to breastfeed/chest feed. Public health implications. Current policies fall short of addressing these compounded effects. There is a critical need for integrated climate and health policies, including improved lactation education and nutritional support. These findings highlight how climate change intensifies the difficulties already faced by lactating women, particularly in the southwestern U.S. Rising temperatures and water scarcity pose additional threats, and the situation is even more severe for low-income individuals with limited access to healthcare services. For example, Arizona's extreme heat presents significant challenges for maternal health and infant care. Moreover, addressing the social determinants of health is essential. Marginalized populations, including those in rural and underserved areas, are at greater risk for adverse outcomes, yet they often have the least access to resources necessary to mitigate the effects of climate change and heat stress. Policies must prioritize health equity by ensuring that all individuals, regardless of their socioeconomic status, have access to health care, nutritional support, and lactation services. In conclusion, our review reveals that climate change poses serious challenges to lactation, with heat stress, water scarcity, and malnutrition being the primary risk factors. Vulnerable groups such as low-income and rural populations are disproportionately affected, leading to wider health inequities. To mitigate these effects, public health interventions should focus on expanding access to lactation support services, particularly in low-income and rural areas, implementing nutritional and hydration support programs specifically for lactating individuals facing environmental stressors, strengthening public health policies to integrate climate adaptation strategies that account for the specific needs of breastfeeding/chest feeding individuals and their infants. Our findings underscore the urgency of integrating maternal health, especially lactation support, into broader climate change policies. Policymakers, healthcare providers, and public health professionals in the southwestern United States and other climate-affected regions must prioritize the following actions: expanded access to lactation services for marginalized populations, the implementation of hydration and nutritional support programs for lactating individuals facing environmental stressors, and the incorporation of lactation considerations into climate adaptation policies to protect individuals and their infants in a warming world. By addressing these challenges now, we can safeguard the health and well-being of future generations in an increasingly warming globe. If you would like more information or wish to collaborate on this important issue, please feel free to reach out to me at dtrailer, followed by the number 1, at ewu.edu. Thank you.